Hello class, I'm Brian and I'll be presenting on the patient-specific functional scale. This is a good assessment because it's client-centered. The client chooses up to 5 activities that they find meaningful but are having difficulty performing because of their injury. It's a useful questionnaire that can be used to quantify activity limitation and measure functional outcome for patients with any orthopedic condition. So today I'm going to be assessing Teresa, who is a 65-year-old female with osteoarthritis. Okay, let's get to the assessment. Okay, hello Teresa, I'm Brian. I'll be your occupational therapist today.
Hi, Brian.
Today we're gonna do an assessment to find out what activities you're having difficulty with. So I'm going to ask you to identify up to 3 important activities that you are unable to do or are having difficulty with as a result of your osteoarthritis.
Okay.
Today, are there any activities that you're unable to do or having difficulty with because of your osteoarthritis?
Today, my biggest problems are being able to brush my teeth, like holding the toothbrush, opening the jars to get ready for breakfast, and I haven't played the piano in the past week, so that's my other activity I'm missing.
Okay. All right, so on a scale from 1 to 10, 10 meaning you're able to perform the activity at the same level as before you got your osteoarthritis, and 0 meaning you're unable to perform the activity at all, how would you rate brushing your teeth?
Today I'm at a 6.
At a 6, okay. And then opening jars?
It's really challenging for me, so that's about a 2.
2. And then playing the piano?
I haven't done it at all this week, so I'm going to say that's a 0.
Okay. All right. So then we would do a follow-up assessment in a few weeks. And so 2 weeks has gone by, and this is the follow-up assessment. Hi, Teresa.
Hi, Brian.
When I assessed you 2 weeks ago, you told me that you were having difficulty with brushing your teeth, opening jars, and playing the piano. Now today, do you still have difficulty with those activities?
Brushing my teeth isn't so hard anymore. I'd say it's almost all the way better. It's at an 8 today.
Okay.
Opening jars, it's not all the way better, but it's better. So that's going to be a 5. And I started playing the piano again, but it's still pretty challenging. So I'm going to rate that a 2.
Okay. All right, so to get the... Okay, so to get the total score for her initial evaluation, she rated brushing her teeth at a 6, opening jars at a 2, and playing the piano at a 0. So I would add all that up and then divide by 3. So that's 8 divided by 3, which is 2.6, and that would be her score for her initial evaluation, or initial assessment. Then 2 weeks later, she rated brushing her teeth at an 8, opening jars at a 5, and playing the piano at a 2. So that's 15 divided by 3, the number of activities, 3. And so that would be a score of 5. So that's important for OT because it's a good way that we can show progress, that her functional activities are improving.